After another week of record-shattering COVID numbers, it's clear we're not just losing the fight against the pandemic, we're getting crushed. And with nearly 200,000 new cases a day, record-high hospitalizations, and more than 280,000 total deaths, it's only getting worse, with officials warning we haven't even seen the full fallout from Thanksgiving gatherings yet. As a result, several cities have been tightening their pandemic restrictions, and in California, a strict stay-at-home order went into effect at midnight for more than 85% of the state through Christmas. Here in Massachusetts, we topped 11,000 total deaths over the weekend, putting COVID on track to become the leading cause of death in the state. And overall case rates are up 70%, with test positivity rates jumping from 3 to 5% over the past 2 weeks. And again, that's with all the asymptomatic people who are getting tested multiple times per week included. Yet still, at a press conference this afternoon, Governor Charlie Baker appeared reluctant to take similar steps here, at least for now.
We're taking a good look at the data as we have been post-Thanksgiving. And I fully expect that at some point we'll make some decisions with respect to that.
Watching and waiting, I guess. The governor did announce expanded testing efforts around the state and said hospitals will be curbing elective inpatient procedures to free up healthcare staff to care for the influx of COVID patients. But overall, Baker largely emphasized personal responsibility in curbing the spread.
I talked to several mayors over the weekend who are frustrated with me and frustrated generally, okay? But to a person, they all said that they see in their communities all the time people engaging in risky activity that we have all been talking about as the sort of thing that you should seek to avoid. It's critically important for people to up their game. And as we head into this holiday season, even more so. Those are the rules in this game that we all need to play by to keep ourselves and others safe.
And while the governor is surely right that there are plenty of instances where individuals could be doing more, plenty argue the state could be doing more too. Like the dean of Brown School of Public Health, an occasional guest here, Dr. Ashish Jha, who wrote over the weekend on Twitter, "For many months I defended Charlie Baker against critics, saying our governor has done a good job. Over the past 6 weeks, I've gone from uncomfortable to aghast at lack of action. It's incomprehensible. They must see different data because no rational explanation for lack of action." Joined by Dr. Vanessa Kerry. She's director of the Global Public Policy and Social Change Program at Harvard Medical School, a physician at Mass General, and the CEO of the nonprofit Seed Global Health. Dr. Mark Siedner is an infectious disease clinician and researcher at Mass General's Division of Infectious Diseases. Doctors, it's good to see you both. Thanks for being here.
Thank you.
Dr. Siedner, if I can start with you, do you agree with Dr. Jha's assessment of the lack of action on the part of the governor?
Well, I think the governor here is really walking a tightrope. It's a little bit, he's stuck between an economic hard place and a epidemic rock, if you will. Mm-hmm. I do think that we have seen very alarming numbers over the last few weeks. And I do think that, as he mentions, we put it in the public's hands for the last few months to take responsibility and do this for themselves. What we can say for sure is that our hospital system has a breaking point. And if these trends continue, when we reach that breaking point, our ICUs will be overloaded, our hospitals will be overloaded, and we're going to be seeing mortality rates increase faster than we have in the last few months.
Dr. Kerry, are you with Dr. Jha on this? He has said he has defended the governor's actions pretty relentlessly on this show. This is a change of direction for him.
I think it's I like what Mark said. The reality is that the governor and all of the leaders are always trying to figure out what is going to be the worst scenario and cause the most harm, right? If we close down all of our businesses, people get harmed because they're out of work. We're in a holiday season. They lose income. There's already food scarcity. A lot of people, don't have access to, steady food supplies. So I understand that. The reality is, from my perspective, though, is that we are looking at a very alarming trend in the rise of rate of cases. And that's not all just increased testing. That's actual positivity. My colleagues are telling me that they're seeing kids come into hospitals positive, asymptomatic, not sick, but just testing positive. It is in our community. We had Thanksgiving. A lot of people were out and celebrating ways they shouldn't be. So the cases are alarming. The problem is hospitalizations, which is one of the things the governor has used to say they're not rising at an alarming rate. Those delay by a few weeks from the case spikes. So we're looking down a road of seeing much higher hospitalizations. So, and at the end of the day, health security is our economic security. If we cannot get control of this pandemic, we're not going to be able to steadily open our businesses and get things back to normal.
You know, but Dr. Siedner, I agree with the last words out of Dr. Kerry's mouth. But getting back to the financial constraints, Shirley Young in the Globe has written a similar thing, saying because the federal government has abdicated its responsibility on so many fronts since the CARES Act many months ago, the governor is in that hard place you talk about. But to quote somebody else who is pretty well respected, close the bars and open the schools, Dr. Fauci. While our bars are not open, our tanning salons are, our gyms are, our casinos, our damn casinos are open in the state. And so if the federal government never comes through with adequate funding, do we just stay the course and let these numbers continue to grow? Or do we have to make hard decisions about restrictions to keep people alive and safe?
Absolutely. I mean, to your first point, I think we're asking employees of these industries to make impossible decisions. Do you, as Vanessa said, provide for yourself and your family, or do you protect yourself from infection, which you then may transmit to others? If that's an impossible decision to ask people, the real solution is, as you say, a federal government response that funds appropriately the ability to allow these businesses to stay open, and you stop people from having to make this impossible decision. I think Governor Baker's been trying to walk this line. There are tens of thousands of people in the state in the tourism industry. Shutting that down, hard stop, does increase food insecurity. But as Vanessa also said, and as you're saying, there is a limit to this. And I actually believe that we're quickly approaching that limit. So it takes about 3 weeks from someone who gets infected to require an ICU bed. We're currently at 1,000, 1,500 hospitalizations in the state. We were at 4,000 in April and well past our breaking point. We've done everything we can to try to expand beds, but we don't have 3 more weeks today, I think, to wait to see if we reach those numbers. The main difference in the epidemic now and then was that back in March and April, there was a high proportion of older people that were being infected in nursing homes, et cetera. If, as Vanessa says, people are going home for Thanksgiving, they're going home for the December holidays, young college kids are now interacting with older people, and that older age group ends up getting infected again at high numbers, our hospitals will surge, our ICUs will surge, and we'll be past the breaking point that I actually think we won't be able to control. So at the end of the day, the answer is yes. It's time to start making some difficult decisions.
Dr. Kerry, how bad? I mean, if it turns out the Thanksgiving numbers, which everybody agrees are going to pump up, even these elevated numbers are ahead of us, and Christmas is whatever it is, 2.5 weeks away, where most experts predict it's going to be worse, and it's getting colder. Can you do a little Nostradamus for us? And what does Massachusetts and America look like in January if we stay the course in terms of our personal behavior and in terms of governmental lack of additional restrictions on our actions?
Well, I think that's the real question, right? The United States just had 1 million new cases in the last 5 days. We are talking about a rise that is so massively escalating, it is terrifying. And we are going to far exceed what we thought were our worst case projections, I think, many months ago. The hard part here is that every day actually matters. There's that famous anecdote out of the Spanish flu where St. Louis shut down its activities within the first 20 cases it found in the city of having the Spanish flu, and it had less than half the deaths of Philadelphia, which waited another 3 days to implement basically the same measures. Every day can make a difference in this case in terms of it, but it also has to come with leadership and the willingness to guide people on what is the right thing to do right now. I don't blame people for wanting to see their family. I've seen my father a handful of times with a mask outdoors, really far away. I have not seen my in-laws in over 1.5 years. We've not seen almost anybody. It's painful and it's hard. We only have a few more months to go if we can just find our way through it. But the problem is the weather's bad. We're going indoors. It's the holidays and people are tired of this. And we've also not been given the tools we need as either our governors or our state leadership, or as us as citizens to know how to adequately protect ourselves, because the messages have been so mixed all the time. But it comes down.
I think.
Yeah.
Go ahead. I'm sorry. It comes down to what?
The same critical message: wear a mask outdoors, wear a mask indoors, wash your hands all the time.
Yeah, but if I may, I think you make the best case for further government action, because it's like Groundhog Day every day in this country, where someone like you two say not all you have to do. You have to wear a mask, you have to socially or physically distance, you have to wash your hands. How many times are we going to say it without realizing there is a significant chunk of our neighbors who are not going to do it? And my attitude about government is, when it turns out individuals won't take enough responsibility on their own, that's when there's an obligation for government to make the kind of tough choices that may hurt. But can I change the topic for a second? I want to argue about that. What is life like? I don't have any concept how people like you and your colleagues go to work every day, knowing that people I am fairly responsible, but like a lot of people are going to end up in their hospital or their ICU are not taking the precautions. And if they did, they wouldn't be there, and that healthcare provider wouldn't be at risk. What's it like in the hospitals, Dr. Siedner?
Well, I'll say two things in response to that. One is, this has been a hard year for everyone, but I think the healthcare workforce has been particularly hit hard. For the last 10 months, it's been extra shifts. It's been watching people die who sometimes shouldn't be dying for any good reason. And it's been asking a group of people to take on the mental health stress of this epidemic. And I think one of the major concerns that we have as healthcare providers and as scientists is that all of this ask keeps on coming back to this community. That really is eventually, even if there are enough beds, going to reach a psychological breaking point. And I think it goes from everything from the nutrition worker to the janitorial staff, to the nurses, the doctors. The whole spectrum is exasperated. And I think we need to keep that in mind when we ask, okay, let's just wait for 3 more months with a surged hospital. That is a healthcare workforce. The second thing is, frankly, the people that we see in the hospital aren't the people you just mentioned. It's not the people that had the backdoor barbecue, because those people are 25 years old. It's the people that they saw in the grocery store unwittingly who have to be working there every day. It's the cab drivers. It's the people that are frontline workers that are working in places with less healthcare access, that are older age and don't get to make these decisions. Should I go out today or not? Because as Vanessa mentioned, they have to go out for the security of their family. And so I think the real inequity we're seeing here is that the people in the hospitals who are getting sick are not the people, by and large, who are actually violating these rules.
What are you seeing in your coworkers, Dr. Kerry?
We're exhausted. I mean, it's really, to Mark's point, it's very, very painful to go into a hospital and to have a father 4 doors down from his son, and to have one be intubated while the other is actually able to leave for the floor. It's very, very painful to walk a hallway and see entirely people from minority communities or minority predominant communities or not as wealthy communities that don't have access to resources or backyards or those backyard barbecues, right? So the story gets told every day in the names and the patients that we see. But, the truth is, young people are getting sick. I had at one point where half my service was under the age of 35. No other medical problems. It was terrifying. So we cannot act with the kind of hubris that we will escape this or that we don't know. And we are responsible. I mean, we are truly, truly responsible for other people's lives. So when we think about the fact, and what I'm going to say might be really controversial, you were tried for murder when you endanger somebody else's life. If you are knowingly walking around exposed with COVID and not taking the kind of precautions that needed to be had, you are knowingly endangering other people's lives. That is very painful for us as physicians who see an opportunity to protect yourself, to protect your community, to protect people differently. This will spread inadvertently. It's a very contagious virus. But the degree that we have control and we know how to stop it, and we do, we have to exercise those controls. And it is hard for us. We're exhausted as healthcare workers, but yet my heart actually is way more pained for the people who have lost somebody in their life to this disease, or who have somebody else in an ICU who are battling for their lives. That's the part that hurts the most. And we have a lot more of that, thousands more of that ahead if we're not careful or change our behavior or put leadership and the kind of guidance in place that could make a world of difference. because we can't have different strategies in a state to different towns. That's not going to work. People just get in a car and drive.
We got to go, but speaking of leadership in the right positions, I know if we had more time, you'd speak glowingly of your colleague, Dr. Walensky, but she'll be in the right place pretty soon at the CDC. Dr. Kerry, Dr. Siedner, thank you so much for your time, both of you. I really appreciate it.
Thank you very much.